Coronavirus, or COVID-19, is described as a disease caused by an unconventional coronavirus that initiated a respiratory epidemic in Wuhan City, Hubei Province, China. It is considered a serious acute coronavirus 2 syndrome, SARS-CoV-2, earlier referred to as 2019 nCoV. On 31st December 2019, China reported to the World Health Organization about a bunch of cases of pneumonia. On 30th January 2020, the WHO declared the outbreak of COVID-19 as a global health emergency.
The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries. Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill-prepared to deal with it.
COVID-19 was declared a pandemic worldwide on 11th March 2020, the first of its kind since the H1N1 influenza pandemic was announced in 2009.
In late April, WHO announced the emergence of a novel influenza A virus. This particular H1N1 strain has not circulated previously in humans. The virus is entirely new.
The deadly virus started to make headlines worldwide at the beginning of 2020, owing to an unprecedented speed of spread. Its basis was followed up back in December 2019 to the food market in Wuhan, China. From there, the virus made it to countries as far as the US and the Philippines. The virus, officially known as SARS-CoV-2, has been responsible for millions of infectious diseases throughout the world, causing hundreds of thousands of deaths. The USA and Italy are the most adversely affected countries. The effectiveness and effect of the repression and control policies have been extensively studied. They are being introduced by many governments to slow down the spread of infectious diseases. Social distancing of the population as a whole, as well as other initiatives like home self-isolation, school and business closures, are highly recommended. According to the CDC, people are at a greater risk of getting infected by public transportation, paramedics who treat COVID-19 patients, close contact with infected patients, and travelers returned from places where local spread has been reported. Like the rest of the world, Pakistan has also battled the serious threat from the last 7 months caused by the novel COVID-19. The system's overall response to the corona is not as terrible as it might have been with the disintegrating medical facilities, restricted test kits, and PPEs. When the very first COVID patients were reported to the state on February 26, 2020, one in Islamabad and the other in Karachi. The National Command and Operations Center, NCOC, was established as the National Core Committee, NCC, arm for lawmaking and policymaking that is the leading agency of the government in its fight against the coronavirus pandemic. The NCOC was formulated as a bridge between the provincial and federal governments on social and economic issues and was also created as a manifestation for the approval of like-minded determination on the coronavirus issues. Efforts have been made by the federal and provincial governments, but the smart lockdown policy proposed by Prime Minister Imran Khan was instrumental in narrowing the gap. The number of new cases decreased due to the smart lockdowns in different parts of the country, while the pace of recoveries has remained the same. It was encouraging that the NCOC recommendations were being followed throughout the country. Due to this, all the projected positive case figures were proven wrong. As many as 57% of patients have recovered, and only 43% cases are involved, according to the NCOC, on COVID-19. Previously, it was feared that by the end of June, there would be 300,000 cases across the country. On the last day of June, the number of cases only crossed the 200,000 mark. The NCOC data showed that on Sunday, only 467 of the total 1,525 ventilators solely dedicated to the COVID-19 patients were occupied across the country. Confirmed COVID-19 cases in Pakistan, on the other hand, were 232,000 cases, in which 132,000 patients are treated and 4,762 deaths were reported. Meanwhile, the reported cases of COVID-19 across the globe are 11.6 million according to the World Health Organization, while 6.27 million COVID patients have recovered so far, whereas death rates have reached 537,000. The chief of the WHO praised the Pakistani government, saying it was quite encouraging to see how the government of Pakistan, even with its limited resources, controlled the virus to a significant level due to the coordinated efforts of the federal and provincial governments and health and emergency departments across the country. The number of active cases in Pakistan dropped to 43%.